people often have concerns if they're iron deficient and taking iron to get rid of iron deficiency when their hemoglobin is already normal or too high, that they're going to raise their hemoglobin to an even higher state. And it is important to recognize that high hemoglobin is completely independent of iron status. Low hemoglobin can be due to a lack of iron, but you can have a high hemoglobin level, in your CBC and still be iron deficient. This situation, of course, is why many people suffering with iron deficiency, they get overlooked year after year, decade after decade, even sometimes, suffering, right? Because their hemoglobin on the complete blood count is normal or it's even high. But because iron or their ferritin levels were never checked, nobody knows. Their symptoms are chalked up to a psychological disorder or hormone imbalances, or it's all in your head, you're depressed, you're anxious, you got heavy metals, you got mold. One of these things, when all along it was iron deficiency. So I would note that if you do have a high hemoglobin, you really want to get to work on figuring out, why is my hemoglobin high? Because a elevated hemoglobin is generally associated with poor health outcomes. So we got to get it checked out. So I was going to go through just a few reasons why your hemoglobin may be high. It has nothing to do with iron. All right. So a high hemoglobin could simply because you're dehydrated, which can be remedied, right? Simply by cutting out some of that ultra processed food and hydrating your being with purified water. Dehydration increases the hemoglobin concentration because there is a decreased plasma volume when there's not enough fluid around. So next up is hemoglobin could be elevated because you live at a high altitude. Say you're living, at 12,000 feet in Colorado. And this would be a normal adaptation. Now, not everybody's hemoglobin is going to be elevated, but I find many patients who went from Washington to Colorado to live do end up on that higher end of the hemoglobin. And this is literally due to atmospheric pressure being lower at a high altitude and causing lower oxygen saturation. So the body creates more hemoglobin. Number 3 would be smoking or vaping. You don't want to do these things. This is a common cause of increased hemoglobin, which is essentially your tissues, if you're the smoker, if you're the vapor, responding to a state of chronic systemic hypoxia, low oxygen. And hemoglobin concentrations rise as the body is trying to compensate for the low tissue oxygen levels. If you don't have oxygen, you can't make energy. So this then, you get thick blood, increased risk of clotting, thrombosis. You don't want that. So vaping, smoking, gotta go. Also, heart disease, lung disease. They can be caused by vaping and smoking, but they can also cause high hemoglobin levels, especially chronic heart and lung diseases. Another one that I think is way overlooked is undiagnosed sleep apnea. This can cause high hemoglobin because there's stimulation of red blood cell production because the body is going hours a night starving for oxygen. So if your loved one is snoring all the time or is waking up in duress, get them a sleep study. All right, the next one is chronic inflammation. It's one of the most common reasons I see in my office for elevated hemoglobin. I think this is where it's important to look at the whole picture, the whole lifestyle, food inputs, exercise, breathing routines, chronic stress and how people are metabolizing it, and even underlying autoimmune conditions as to why the hemoglobin is high. And then we have testosterone replacement therapy. So TRT, very common intervention that can lead to elevated red blood cell production and a high hemoglobin. This is much more common in males, but recognize if you are on testosterone replacement therapy and have low iron levels because maybe you've been donating blood, but you have high hemoglobin, raising your iron to the optimal level will not I said that will not increase your hemoglobin beyond normal. Iron is not a stimulator of erythropoiesis or red blood cell production like testosterone. And in line with that, just because your hemoglobin went up on testosterone replacement therapy doesn't mean your iron became sufficient. Those are two totally different mechanisms, two different processes going on there. So like I mentioned earlier, when hemoglobin is elevated, the viscosity of your blood, my blood, goes up. So you have thicker blood that increases the risk of blood clots, thrombosis, and decreases blood oxygen to tissues or blood flow as a whole to tissues. So we're talking like the brain, we're talking the heart, we're talking the intestines, which of course then leads to the breakdown in the function of those organ systems. So we don't want a high hemoglobin. We want to make sure we get that taken care of, figured out what's going on there. And checking just one level, one time, rarely gives us, a great understanding when it comes to a high hemoglobin. So if you got a CBC, high hemoglobin, man, get the whole gamut. Look at the whole person. Look at the whole symptom picture, all the signs, put it together. Consider other inflammatory markers, thyroid, hormones. Don't accept anything less than health accumulation. All right, I'm Dr. Matt. Hope this is helpful. Please let me know any questions you have in the comments, and I'll make another video on answers to those questions. Talk to you guys later.